Hello everyone, welcome back to my channel. Today I decided to make this video for you, and I'm gonna speak about Hydrate Medical Clinic that located in wonderful part of North Carolina in Asheville. You can see how plaza looks from outside. So in the case you wanna come and set up an appointment in a clinic, so you would know what you looking for. This is how it looks from outside. So I'm gonna take you inside where Dr. Dula will meet us and give us a little tour in the clinic, and then we'll start our interview about IV therapies. Okay, so we're walking inside, and this is the waiting area. And hello, Dr. Dula. She's here for us.
Thank you for
Good.
coming. It's good to see you.
Sure, good to see you too.
Yeah, I would love to show you my clinic.
Yeah.
So this is the waiting area, and patients come in here to get IV fluids for dehydration for lots of reasons that we will talk about. So you can come in and sit down, and there's different places to pick to sit to have your IV. So you can sit here in the sofas and sit upright and prop up however you want to. And we have a television you can watch while you're getting your IV. And then we have another area back here if you would like to lay back more and relax, or even sleep. Some people sleep while they have their IV. And we have little partitions so we can section it off if you want to be more by yourself. If you're not feeling well, if you're sick, or just really want to be by yourself, we have another area where you can sit in a private room. I can show you the restroom on the way out.
Sure.
So this is our little private room area here. And as you can see, we have just the one bed in here, and we can turn down the lights if you're not feeling well, or even turn them all the way off.
Very nice. Let's go
And then
to
back
more.
here is where we make up our IVs. And so we have the little sink area so we can prepare them. And our IVs are warmed in the warmer, so they're more comfortable when you get them.
Okay. Now let's go back. And
Okay. And then this is our little restroom if you need it.
okay. So I think we covered all clinic. Now, guys, we're gonna have most interesting part. You would learn a little bit about IV and what Dr. Dula does in her clinic. So let's start it. Okay, guys, I hope you like overview of the clinic. And today we're going to have our second interview with Linda Dula, who is a doctor of the osteopathy, and she is board certified in family medicine. She is also certified for prolotherapy by American Association of Orthopedic Medicine. And yesterday we did our first interview with Dr. Dula. We spoke about prolotherapy, and I'm gonna leave the link under the video so you would be able to click on the link and learn and listen about this wonderful therapy. So hope you're gonna enjoy that. And today we're gonna speak about IV therapies. So let's start with our first question. Dr. Dula, what is IV hydration?
So IV hydration is getting fluids into your body through the vein. So we do put in a needle and start fluids into there. When you get an IV, it goes directly into the vessels and the tissues, so you're going to be hydrated quicker than you are drinking water. Of course, you should drink water, and we want you to do that too, but it will go in faster and be absorbed better by getting it in an intravenous IV.
Why do you think people have to choose IV hydration?
Well, as I said, it goes in quicker, and so if you've got an illness, if you have cold or flu, if you've been exercising hard, if you have a hangover, it's going to work a lot quicker. You can rehydrate drinking water, and it will take several days. When you get it IV, you will rehydrate within a few hours.
So when we think about hydration, usually people think about just drinking water, like good quality and good quantity of water. So what is the difference between drinking water and have an IV?
Well, when you drink water, you're drinking what we call free water with no other things in it. When you get IV, you have to have electrolytes in it because your fluids in your bloodstream have electrolytes naturally. So you don't want to put plain water in, or it would be very hard on your body. So we give fluids with some electrolytes, normal saline. Some of them have a small amount of potassium or calcium. These are physiologic amounts that are normal in the body, and so we give it that way when we do it IV.
I see. Who are the best candidates for it?
Well, a candidate is anyone who's dehydrated for any reason. So, like I was talking about, if you've been sick, if you've had cold or flu, if you've been exercising hard, and we have a lot of bikers and runners in Asheville, a big CrossFit community, and just people who've been outside in the heat. So any reason like that is a good person to come in for this, and we evaluate you medically to see if you're a good candidate as well. We will check your vital signs and your history and determine if you are a candidate for
I
IV.
see. It's nice to know. So I know you also offer home visits. And who can request home services? Do you have to have some kind of special needs, or this is for people who are disabled, or anybody can have it on the comfort of their homes?
Yeah, anybody can have it. Definitely if you are disabled, but you don't have to be. We will come to your home if you just don't feel like you're able to get here, or if it's more comfortable for you to do it at your home.
I see. Is there any price difference between office visit or home visit?
Yes, it is more expensive to have it at home because we are sending a doctor or a nurse to your home. So we charge $200 over and above the cost of the IV for during the day, during our office hours, and $300 if it's outside of our office hours.
I see. So I know you offer a protocol for chronic illness. Can you speak a little bit more about that? What kind of illnesses are they, and what kind of protocols?
Yes, we have several protocols for chronic disease. We have our detox protocol, and it was designed for patients with residual effects of Lyme disease, but it is also indicated for patients with Parkinson's, with lupus, fibromyalgia, Epstein-Barr disease, and then we also have high-dose vitamin C that is mainly used as a cancer protocol.
So can you speak a little bit more about vitamin C, correlation of vitamin C and cancer protocols?
Yes, there's good research on the vitamin C for cancer. Vitamin C is very absorbable by the body. You can't take very much orally because it won't pass through the gut very well. But IV, you can take a larger amount, and there is actually a protocol that lets us measure what is a therapeutic dose. So there's a lab we can check here in the office before and after, and it tells us the level that has been found to be therapeutic at shrinking tumors. And it works very well. It creates a reactive oxygen species in the blood and gets into the cancer cells and reacts like peroxide in the cancer cell, helping to kill it.
So now I'm looking at your chart, and I see you have different names for IV sets. So what is the substances do you use in a different these sets, you know, I should ask this question, right? So
Yes.
can you mention, let's say, some of them? I see the name of them. You have like Hydrate Epic Hangover, Hydrate Beauty, Myers Cocktail. Let's say, as we're females, right? Let's ask about Hydrate Beauty. I think every woman would want to know what's in a Hydrate Beauty, what's going to make them beautiful.
Yes,
Yeah.
we all want to know that. So the beauty protocol is, we call it that because it has some basic vitamins in it. It has vitamins B and C and B12, calcium, magnesium, but it also has a high amount of glutathione. And glutathione is a substance that is detoxifying to the liver, and it's very supportive of the membranes in the skin and all of the membranes in the body. So it works very well, and over a period of time using it, it will really lighten and brighten the skin.
So I think for glutathione we have to dedicate to glutathione special time, because it's definitely not enough to mention about this one wonderful substance like in a couple of seconds. So we're going to cover that later also. This is one of my favorite topic, and I also tried glutathione therapy by IV method, and I can't say enough of that. So we're going to speak about that maybe in our third interview. So stay with us, guys. So, and like I know from my childhood that all IV, since I'm from Russia and IV was very popular in Russia and still very popular, so I know that IV and the shots gets about 100% of absorptions. And since it's get right to the bloodstream. So what is can you just briefly just describe what is the difference between the oral supplementation and the IV, doing the IV?
Well, we add vitamins and minerals to all of our drips, and they will be absorbed much better, as you said, taking them IV. Whenever you take any substance orally, it has to pass through the stomach, and the acid of the stomach breaks down a lot of that. So you're going to absorb 50% or less if you take it orally, where when you take it IV, it goes directly into the vessels and the tissues and is much better absorbed, particularly some like glutathione.
Glutathione, yeah.
Yes.
So how long it takes for one bag to drip, or like how many cc's do you use in one bag?
Most of our IVs have 1 liter, which is 1,000 milligrams. We can do smaller amounts. Our Myers cocktail actually comes in only 100 milligrams, but we usually add it to a liter of fluid because most people that come in are really wanting the fluid as well as the vitamins and minerals. It's a good option for someone who has CHF or some reason that they can't take larger amounts of fluid. It takes about 30 to 40 minutes for the IV to run in, and some of our protocols on our main menu offer 1 or 2 liters. We always evaluate to see if you're able to take the second liter, and so if you do get a second liter, it will take another 30 to 40 minutes for that to go in.
So can you explain what is CHF means?
CHF is congestive heart failure, and people with congestive heart failure have to be very careful of their fluids so that it doesn't overload their heart and lungs. So they cannot, we would be very careful about giving a CHF patient any of these, and would definitely not give them very much fluid with it.
Sure. And now probably we all want to know that we live in a world dominated by 3 main killers. Number 1 is cardiovascular diseases, number 2 is cancer, and number 3 is diabetes. Can any combination of IV fluids prevent or even maybe reverse the process of these evil diseases? What you can say about that?
Cardiovascular disease is the main killer in the U.S. and all over the world. Symptoms can be made worse because people do not absorb their nutrients well. So getting IV will help keep them hydrated, and it will also add necessary nutrients like magnesium and calcium and things that they may have difficulty absorbing through food and otherwise. For diabetes, it's not going to help with the diabetes itself, but dehydration is a big issue with diabetes because sugars in the blood cause people to be very dehydrated. So just maintaining hydration is going to be very helpful for diabetics. And for cancer, we do have the high-dose vitamin C. We use the Reardon protocol that has been found to shrink tumors. So these are some things that we can actively address with some of these critical diseases.
So what people has to consider before they come here? Do they have to bring you some blood test results, or how does it work?
Most patients don't need to bring any labs. We don't require them. We do evaluate them medically, and this is run by a physician and registered nurses, so they will be evaluated before they get their IV to determine if they're a candidate, and monitored very closely while they're getting the IV. And we do require labs for some of the chronic protocols, but not for our regular panel of IVs.
So how safe is it, and who's running that in your clinic?
This is done very safely and well. We manage each patient medically, and I am the physician, so I oversee all of the IVs that are given, and registered nurses are here, so it will be one of us giving the IV, and it is managed well and licensed by the state of North Carolina.
So that's nice to know who's doing that in a clinic. And I just also, as always, I would like to mention a little bit of history, that this therapy is not new at all. The concept goes back to 1600s, but back in 1600s they were applying that on animals. So back in 1800s they started to apply that on a human body. And what was interesting, that before 1940 the only doctor used to administer this therapy on people, and after 1940 registered nurse was allowed to to start to apply the medicine, apply the IV on a human body. So that's why it's very safe. And yes, I just would like to mention that I had several IVs in the clinic, and it's wonderful. All nurses are so very well educated, I would say, so they exactly goes right to the vein. And I never, with my very thin veins, I usually have problems in other places, and I never had any problems here, so they just poking to the right area without any problems. This is very important, because a lot of people have needle phobia, and they kind of afraid to come and thinking that they're going to have a lot of bruises after all. And I was one of the candidates for that. So, but in this clinic, it's extremely safe. So I recommend everyone to try that. So, do you want to add anything to our interview?
So a lot of people tell me that they're afraid that they're going to have to run right to the bathroom, or even while they're having their IV. But because this goes into the vessels and the tissues and not through the GI tract, you may not go right to the bathroom immediately. You will over time, over the next several hours, but maybe not right away, because this is going right out to your vessels and tissues where your body needs it. So it'll go there first before it goes out of the body.
It's nice to know, because there's a lot of little questions can stop people from from coming to and experiencing this wonderful the procedure. And I just would like to mention that all address and everything is always going to be right there, so you can see it right now. And so we all welcome you to Dr. Linda Dula's clinic in Hydrate Medical for IV therapy. First of all, I would like to thank Dr. Dula for having me in her clinic, for inviting me to her clinic for this wonderful interview. I'm really enjoy being here. And another thing, I just would like to mention that we made another interview number 1, that we made actually yesterday about prolotherapy. So you're gonna I'm gonna leave the link under this below this video, so you can watch that too. And these 2 different therapies Dr. Dula does in different clinics. So one, Hydrate Medical for IV therapies, and prolotherapy in Prolomed Clinic in the South Asheville. So. Also, I just would like to mention, please sign up for our channel. It's very informative. We get lot of information out to you guys, and like our videos, and we're always happy to answer your questions that you have, and always happy to have you in clinic of Dr. Dula, and I'm always happy to have you guys in my clinic, which is Zero Health. And again, in the future, it's going to be probably in a couple of months, I'm going to incorporate IV therapy in my clinic as well as prolotherapy. So just look for that, and stay tuned to our channel, and it was really nice to see all of you again. Thank you, Dr. Dula, for this wonderful interview, and we'll see you very soon, I hope, with our glutathione, right? It's one of the big, wonderful topic. So we really enjoy being with you. Thank you. Bye-bye.
Thank you.